is Cheyenne, and for the EHR case study, I chose Delia, the 16-year-old female who was wanting to know more information about her laparoscopic gastric bypass surgery. From this case study, it sounds like both the mom and dad and Delia herself wanted to know more information about what was expected during post-op care and along with nutrition counseling. It's important to note, though, that Delia his parents are both divorced, and so she spends time with her mom and she spends time with her dad occasionally, off and on. But when she does go to her dad, she likes to spend time with her grandmother, and her grandmother, they're both Greek, so she teaches her a lot about her Greek culture. And it seems like from the case study that it is important to Delia that she recognize it and she eats foods that are associated with Greek culture. To associate more Greek culture foods for Delia, I think that will help with the cultural competency along with health equity, because we can incorporate more foods that are Greek style, especially that are low cost and low sugar. It did mention through the case study that Delia did like to eat foods that were pasta and kind of easy to quick meals. So with her grandmother, we can try to get some ideas going, see what's low cost. Maybe her grandmother would be able to help her make some of these meals where she can just warm it up and then just eat it like a ready to go meal. And then from there, we could also ask if her grandmother would like to come with her to these appointments, just to see like if we're not incorporating enough Greek culture, or if there's some things that we shouldn't be incorporating that is important to both their Greek culture. Same time, this is beneficial for the health dietitians dealing with Delia here, because we are able to ask more questions about the food, and we can talk more about their culture, what they like to eat. This will essentially make the client more able to openness to try new things, be willing to learn more about herself, and then we can learn more about her, how to better her experience for patient care. The client's favorite food that she mentioned on the EHR was she did like to eat sweet foods. So with her grandmother's help and then our nutrition counseling help, we can try to figure out what could be low cost and low effort and still sweet. An example I could think of is possibly non-fat Greek yogurt with some honey on top. That is sweet if she wants it a little sweeter, maybe along with some granola or some almonds, something to give her a little bit more of that boost. So I think this is the best way we can incorporate cultural competency and health equity with this patient, is by, asking her questions about her Greek culture and incorporating it into the healthcare plan. I think that would be the best way.